It's the jawline. It's
Mhm.
the
Yeah.
sagging chin. It's real.
Yeah.
I don't know why, but it really bugs me.
If you're doing a procedure to make you look younger and you end up losing fat, then it can lead to loose skin. So it can backfire on you. I went non-invasive and minimally invasive to get so good that we don't have to have surgery anymore.
Is there a popular look these days? What is it?
I never thought in a million years I would be anti-aging knees, but it is a concern is this skin laxity everywhere else.
Do either one of those work for this? I know a lot of women my age who maybe their
Yeah.
face looks pretty good, but they look at their
Uh-huh.
hands and they're like, wow, that really looks 69. And I'm not a big 13,000 products person either. What's a simple, good routine and what are good products? Welcome to Ageless with Jane McGarry, where we celebrate vibrant health, self-care, timeless style, and finding purpose at every age. Because around here, age truly is just a number. I'm 69. I know, I can't believe it. I don't know what happened there, but I am 69. And we're all looking for ways to look our best at whatever age we are. So fortunately, there are a lot of non-surgical ways to do that these days. And my guest today is someone who has helped me a lot. Okay, I'm going to hold up my paper because I've got to read everything about him. MSN, APRN, NPC, I don't know what all those are, but they're important. Filler enthusiast, research nerd, he put that himself in there. David Weir joins me. Hi, David. It is so great to have you on the show.
Yeah, thank you so much for having me, Jane. It's always a pleasure to spend time with you. So thank you.
Thank you. I really appreciate it. I just want a little bit of history here. So I found David because years ago, I was looking for, this is like 20 years ago, I was looking for the best person in Texas to take care of my skin. I researched and I found Dr. Rod Rorik. And David is in partnership with Dr. Rurik. So that's how we ended up working together.
Mhm.
So, David, can you just talk about why, before we get started on procedures and creams and all that, why what I just said is so important, being able to trust who you're working with when it comes to this kind of stuff?
Yeah, absolutely. When it comes to aesthetics, there has to be a foundation of trust built upon a foundation of knowledge and experience in the field. So, unfortunately, in Texas, it's not really regulated on who can do these types of procedures. And it's per the FDA and nationally, a lot of companies can make different claims that may or may not be as accurate as a patient can perceive them. So, you have to find someone that you really trust, that has good experience, that has a good education, that can help to field the minefield of aesthetics for the everyday consumer. I mean, for instance, there's over 20,000 skincare brands just in the United States. So it's like, which one do you choose? So but finding someone that has the education, the background, and the skill and something like skincare or something that they're passionate about that you can go to that can kind of help delineate, what's good, what works, what doesn't work, what's a fad, what isn't a fad, which has some credence or science to it. That's what it's extremely important to find someone that you trust in the industry.
And we're going to talk about some of the skincare creams that you recommend a
Yeah.
little bit later. But I just want to start right off with something that I
Mhm.
think is a common problem for women my age. And it's something you've done with me several times now. It's the jawline. It's
Mhm.
the
Yeah.
sagging chin.
Yeah.
I don't know why, but it really bugs me. Some other things don't as much, like laugh lines around my eyes. Talk about what Morpheus 8 is what
Yeah.
you've done. It's a radio frequency skin tightening. Is that right?
Yes. Yeah, so it uses radio frequency microneedling, and the needles emit a burst of heat underneath the skin that helps to tighten the skin from the inside out. So it's been around for, gosh, it got FDA approved about 8 years ago. So it's been around for quite some time. It's tried and true, and it works just to help mild to moderate skin laxity. So it's something that's great for the jawline and the neck in an aging female or someone who's starting to get concerned about this because as we get older, everything that's up here slowly starts to end up down here. And that's what causes the jowls and the shadows and the disturbances that you see in the lower face. So the goal of any non-surgeon or non-plastic surgeon is, how far can we push the envelope to prevent aging, slow down the aging process, and reverse the aging process without having to have surgery. And radiofrequency microneedling has been around for, I mean, at least a decade in the United States, and it's gotten great results. I mean, it speaks for itself. You've had it done, so we've done it for you. So yeah, it's a great
Yeah,
procedure.
and when I came to you, I was pretty because my mom had, I think it's hereditary, she had jowls, and
Mhm.
so I came to you and I was like, "What are we gonna do here?" And, so a couple of questions. People always ask me, "How does it hurt?"
Mhm.
Um, how long will it last? That's another class. I guess you did mine 5 years for the first
Probably,
time,
yeah,
maybe?
4 or 5 years ago. Yeah,
And
about
I've
four
had
or
it
five years
done
ago.
3 or 4 times,
Mhm.
and each time, I mean, I'm very pleased, but talk about the pain involved and all that.
Mhm. Yeah, so but we'll get the pain out of the out of the way just in the very beginning. So it does use needles, and they are powered by radio frequency. So it's not it's I don't want to say it's not a walk in the park. It's not the worst thing you'll experience, but it's spicy. It's definitely spicy.
Spicy.
It's spicy. So some patients, tolerate it really well. Some patients are like, David, this is more spicy than I thought it would be. And so we just stop and we do a couple of injections, and that just makes the area go extra numb where you can't feel anything. So there's different levels of anesthesia from topical to injectable that we can use to make it tolerable for any patient. But not everyone requires all the anesthesia. So it just really depends on your pain tolerance. And everyone's really different, because there are some patients that I would assume would tolerate it really well, and they're like, ooh, this is a lot. And then I have some patients who I would assume wouldn't tolerate it, and they're like, is this thing even on? So it is a spicy treatment.
And it
Now,
takes about, people ask me about downtime. It's 5, 6 days downtime.
yeah,
I mean,
five,
you
six
you're
days.
fine, but you
Yeah,
just
yeah.
probably don't wanna go on camera
Yeah,
for
yeah. There's
5 or
there's
6 days.
no there's no real downtime, but there's social downtime. Because you can't have it done and then go to a dinner party the next day and someone not look at you and be like, "What? Something's going on there." Because you're red, you look sunburnt. There's might be some bleeding or bruising involved in it. So it's definitely there's no like downtime where you have to be confined to your home by any means, like a surgery or something like that. But there is social downtime where you might have to tell someone that you had something done to your skin if you see them out in public.
Okay, 2 things about this. I wanna ask
Mhm.
you what's next after
Yeah.
radio, after Morpheus
Mhm.
8, but before we get to that, one of the reasons I called you and asked you to do the show was
Mhm.
because you have to be really careful with this stuff. I read
Well,
it was
yeah.
a Gwyneth Paltrow Goop article
Mhm.
where she was talking about a young woman, 30ish years old, who had
Mhm.
had radio frequency skin tightening. I guess it was too hot or something, and it
Mhm.
really destroyed, because it destroys the stuff underneath your skin so that your skin can be tighter. So
Yeah,
explain
yeah.
what can happen and what you need to look out for when you're selecting someone to do this.
Yes. So, what can happen? So, unfortunately, in aesthetics, sometimes when new technology comes out, people think more of a good thing is better. And what we find is a lot of times more of a good thing is actually worse. So with the radio frequency, at higher temperatures, because it causes the skin to contract because of the temperature. But at high temperatures or too much heat in the skin, it can lead to fat loss. And in your face, if you have a normal BMI or you're healthy, you have a healthy waist size, fat in your face keeps you looking young, and it keeps you looking younger longer. So if you're doing a procedure to make you look younger and they use too much energy and that you end up losing fat, then it can lead to loose skin. So it can backfire on you. So you have to make sure that you're going to somebody that is well credentialed, that has very good experience with the device. And ask that, I asked the question, what's your worst result? What's your best result? And how often do you do this treatment? And those are three questions that you have to really ask. And really, I focus on how often you do the treatment because, there's credence to experience. And a lot of people come to me from out of the state and out of the country, to get these types of treatments just because I've done thousands of them. So, this isn't something that I do once a month. This is something that I'm doing on a daily basis. So making sure that they have good experience with the device, because when it comes with any device in aesthetics, a third of it is the person doing the actual treatment. A third of it is the device that they choose, and then their experience with the device. And then the last third is how well you respond. So it's a combination of those three factors that end up giving good results. And it's just balancing out, making sure that you get all three correct.
Wow, those are really helpful guidelines for
Yeah.
women. Okay, so I said, I'm sure I haven't seen you
Mhm.
for a few months. What is next after Morpheus 8 that I don't even know about yet?
Yeah. So now we're going. So as far as radiofrequency microneedling is concerned, Morpheus is still right up there with everyone else. And there's lots of competing manufacturers that have different radiofrequency devices out there that are just as good. They, just it's a difference of like BMW or Lexus or Mercedes. They're all good cars, but just someone designs them a little bit differently. Now, what's next is now we're blending minimally invasive to non-invasive. So we have non-invasive, minimally invasive, and then surgical. Okay. So now we're getting closer to making minimally invasive procedures closer to non-invasive. So the next wave right now, I would consider something called Ignite RF, which uses a tiny probe. And instead of using needles to go into the skin, it's one tiny probe that we only make 3 little port sites into the neck. And then the probe, if your audience is familiar with this, is a cannula. And it's about the size of I would say a Q-tip. The width of a Q-tip is bigger than the size of this cannula, and that actually goes underneath the skin and tightens it from a deeper level, so even deeper than Morphea can do. But it's completely non-invasive. Or, well, I can't say it's non-invasive. It's minimally invasive, and there's no downtime to it. So what we're doing with Morpheus is we're tightening skin from the inside out. And what Ignite RF is doing is tightening it from the outside in. So we're actually combining these treatments together. So that's the next wave of really going after like how far can we push the minimally invasive category to make it closer to non-invasive, but get more close to surgical like results.
Because I know you and I always laugh because you said that although you work with Dr. Roy, who's
Mhm.
considered one of the top plastic surgeons in the country, you always
Yes.
say your goal is to put plastic surgeons out of business.
Absolutely. Absolutely. I want non-invasive and minimally invasive to get so good that we don't have to have surgery anymore. And I think that's the goal of any non-invasive provider like myself. Now, of course, surgery will always have its place, but the more we can get better, faster results with less downtime, the less need we'll have for surgery.
Okay, what is that? Is there a popular look these days? What is it?
Ooh, so right now, and I'm so happy about this because it's not what it was several years ago. And I'm not going to blame social media or influencers or celebrity culture, but we all know it's there. Okay. And there was a trend about 5 to 10 years ago that was to look done. Like it was almost like a social status to look like you've had something, like the really, really frozen forehead or the poofier lips or whatnot. But now the trend is to look like you haven't had anything done. Like you just look really good for yourself. So now the trend is just looking like natural beauty. Is what I see because now my patients are coming in and instead of one bringing pictures of other people and saying I want to look like this, they're bringing pictures of themselves like 5 years ago or 10 years ago and saying I just want to look like myself. I just want to look better, a better
Oh, I
version of
love
myself.
that.
Yeah. So I see a better trend. So if I could define the look of, 2025 and the future of the next 5 years, it's natural beauty. It's 100% natural beauty. It's looking like you've never had anything done, but you just wake up looking great every morning. And we know that's not how it works.
David, that's so
There's a
funny
lot of
because
work that goes into it.
what I've asked for is
Mhm.
finally in style, because the
Yeah,
joke in the office is I always say, do half as much on me as you would on
yeah,
anybody else.
absolutely, absolutely,
Because
yeah,
my goal has always been to just look as good as I can for where I am in my life.
yeah,
That
absolutely,
is
yeah,
really
and
interesting. Okay. We're going to talk about lasers, skin creams, and other treatments when we come
mhm,
back in just a minute.
sure.
What's the scariest thing to most people? Public speaking, whether it's in front of a crowd or if you're just speaking to a camera on your social media. Most people are terrified of public speaking, and sometimes they miss opportunities because they don't know how to promote their product or to speak well when it comes to public speaking. I've been doing public speaking all my life. I've been in front of a camera all my life, and I've done a lot of public speaking in front of crowds. And I have learned some tips and tricks that will help anybody. If you're trying to improve your communication skills, whether it's a video you want to do for social media, or maybe you have to speak in front of a corporate board, maybe you want to be better on your Zoom calls. I have all kinds of techniques that I teach. I do a master class for corporations that need someone to help them teach their executives, teach their doctors, their lawyers, other professionals who may have a lot of knowledge but don't always communicate it well. Jane McGarry Media is my website. You can book a consultation with me. I would love to help you. I want to touch on facelifts for just a second because I read the other day that facelifts before 40 are
Mhm.
becoming very popular, maybe partial facelifts, that kind of stuff. Could you just
Yeah.
talk about that? And could you address one concern I would have about that?
Mhm.
That the way I understand it, a facelift, you're taking away some of the skin. So do you
Mhm.
risk, if you start at 40, do you risk having too little to work with by the time you're my age?
Yeah, yeah, those are very valid concerns, Jane, and questions that I get in my clinic on a daily basis. The first question is, the facelift at 40 or pre-40. So there is a thing, a wave of prejuvenation. These people who are wanting to fix the problem before there is a problem. Now, um, I'm on the fence on some patients on if I think that's a necessary step. Most of my patients and a good portion of my job is talking people out of things more so than it is talking people into things. Some patients come in and based on their expectation of what they want in their result, sometimes surgery is the answer. And that can happen at any age. But I do see this trend of prejuvenation because people just want to age very slowly and they don't want a dramatic difference. And this goes back to that natural beauty. When we think of facelifts of the 80s and 90s, your auntie or your mom or your grandma just went away for a month and nobody talked to her, and then she came back and she looked like a different person. And typically, it wasn't a good look, because they were pulled too tight or they didn't have the technology that we
Right.
have now. So that's kind of what I see in these prejuvenation cases of these people wanting to have a facelift early. Is like they don't want a big dramatic shift. They don't want to wait until they're 55 or 65 to have it done. They want to have one at 40, they want to have one at 50, they want to have one at 60. So they never age. So I see that as a trend. I see it as a trend, hey, because the average facelift for women used to be 54 and now it's closer to 50. So the trend is moving to younger. And I think patients are just wanting to, prevent the dramatic shift in their appearance. So they're like, if I can have a little bit of work done early on and prevent having that dramatic change in the way I look at 55, they would rather have a facelift at 45 and then another one at 55 and another one at 65 versus having a big one at 60.
Okay. I
Yeah.
mentioned gels. I know that that's a
Mhm.
common problem. What's the second or third most common thing women come to you and say, I don't like this? And what's the treatment for it?
Yeah. So jowls is probably absolutely the number one. And then the second most common problem is the fold here, the nasolabial fold. I get a lot
Oh,
of
yeah.
patients that come in for that and that's just because as the face ages, everything starts to slide down and we start to lose volume at the same time. So this isn't necessarily a problem It's a symptom of a problem of volume loss in the midface. So I would say that's probably the second biggest problem that I get. And we don't actually fix it directly here. We fix it by adding a little bit of cheek volume that they lost, which is the third problem that I get is people come in and they say they look tired. And that's because they lose fat underneath the eye. They start to see separations. The fat pads start to descend and they start to look heavy. And the next thing you know, you have this big fold here that was never here. And then it slides down and you get a jowl. So by revolumizing the middle third of the face tends to fix a lot of everything overall. But I would say the fold here is probably the second most common problem that people come in for.
And Dr. Rourke is actually the one who does the filler on me, and he
Yeah,
will
yeah,
frequently fill right up in here because you can see it. I mean,
yeah,
when you think about it, I'm not a physics person, but when you think
yeah,
about it, if you have a little more fill up in here, it is going to
mhm,
pull everything up.
yeah,
So
yeah.
that's so anything else that women commonly come to you with that there's a non-surgical treatment for?
So probably my favorite other treatment, two things that I'm doing for body laxity right now is a combination of a brand name. I'm going to say the brand name, which is called Softwave, which they don't pay me for that or anything, but it uses ultrasound. So it works in it's in the same space as Morpheus 8 radiofrequency. But it uses a different modality to tighten skin. And I'm getting some excellent results. Me and Dr. Rourke are actually studying it right now for different things, and we're getting excellent results in our study patients. And it's already FDA approved, so we're just playing with it in some combination therapies and getting great results. What I'm also seeing is biostimulation. So those are injectable treatments that stimulate the body's own natural healing cascade to produce more collagen and elastin in the skin, and that's what makes our skin plump and tight. So, Kaha or Radius is a brand name that I use quite frequently, and then Sculptra or PLLA is another brand name that I use, which is an injectable skin tightening treatment that we use for the face and the body.
So you mentioned two different things there. One is
Mhm.
an ultrasound based treatment, and the other one is an injectable that actually encourages collagen.
Yeah, it encourages your own body to produce the collagen. Yeah, it's less instant gratification than your traditional hyaluronic acid filler, but hyaluronic acid filler only volumizes, whereas biostimulation adds volume and skin tightening at the same time.
Do either one of those work for this?
That
The jiggle and the
uh
dimpling.
Yeah. So one of my favorite treatments right now to do on the arms is a combination of Kaha or Radius, soft wave ultrasound, and then something called Pure Impact, which is a EMS muscle stimulation system. So not only because when you get lax skin on the arms, it's typically a combination of as you get older, not only do we lose fat throughout our entire body, not only does the skin become a little bit looser and a little bit larger and thinner, but we also lose muscle tone. So it's a combination of all those factors that lead to that crepiness and that kind of waddling arm that a lot of patients complain about. So when you come to my office, if you're in that trifecta, like you have all three problems, I say, okay, we need to increase the muscle mass, we need to tighten the skin with the biostimulation, and then we also need to tighten the skin with ultrasound. And that trifecta tends to work amazing on the arms. Now, don't get me wrong, every once in a while I do run across a case that's better for surgery. And I have to go over that and say, you know what, you're a better candidate for surgery. And typically that's in my patients that have lost a lot of weight. They've lost, more than 10% of their body weight, or they've gotten on some of the weight loss drugs or something like that, and they've lost a bunch of weight really rapidly. There's only so much we can do non-invasive. And in the non-invasive category, I say, at best, I can probably get you close to 50% improvement, but a non-invasive or minimally invasive. But if you want 80 to 100, that's surgery. So it's always me trying to align the expectation with the reality of the situation.
Okay, another issue. I'm just getting all my questions answered.
Yeah, 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 yeah.
So this is something I should have paid more attention to in my life, but I
Mhm,
didn't. I laid out in the sun with baby oil and all that, like
mhm,
all the boomers. What about brown spots on your face? What
Mm,
about the whole laser thing? What
yeah.
do lasers work for brown spots? What
Mhm.
else could you do? What do lasers work for?
Yeah, so it depends on the laser. There's tons of, well, dozens of categories of lasers, but the gold standard for brown spots is still, it's called selective photothermolysis. It's also called a photofacial. Some people call it intense pulse light. Some people call it BBL. There's lots of different names for it, but it's the same technology, and it uses different wavelengths of light to target the melanin that's causing, so the cell that's causing the hyperpigmentation are the brown spots. Now that's great for like traditional sunspots now, or freckles. Now there are some spots that are benign skin growths, and we call those actinic keratosis. And you'll know what those are. They're typically brown, but they're raised, and you'll feel them on your skin.
My mother
Uh,
had those. I
yeah,
don't
yeah.
think I do, but my mother had that.
Yeah, and those respond better to traditional laser, and that's resurfacing. So that's actually going in and removing layers of skin. So I always recommend, patients, to maintain your collagen, maintain your elastin, especially after you get over 40. About 2 to 3 times a year, you should be doing something to your skin to kind of reinvigorate the collagen process. Of course, when you're younger, you don't have to do it as often. As you get more mature, 50, 60, 70, you have to do it more often, depending on how much maintenance you want. But I always encourage patients about 2 to 3 times a year to be doing something. But laser resurfacing, still a great modality. I do it every day in my office. Great procedure, especially if you're wanting to combine some skin tightening with fine lines and wrinkles that are etched into the skin. But with laser resurfacing, there's downtime. It's about 5 days.
So when you mention collagen, doing something for collagen, what you said 2 or 3 times a year, what are the things that
Mhm.
you recommend to do?
Yeah, so I have a hierarchy based on what your goals are. But my favorite things are going to be RF microneedling, traditional microneedling, intense pulse light, or a photofacial, a chemical peel, or a light laser. So those are like my 5 categories, depending on what your specific skin needs are. If you're going more for brightening, or if you're going more for tightening, or if you're going more for thickening, I might choose one or the other, or a combination of some of those.
Okay, I read the other day, and I don't know whether this was just a random thing I read or not, but I read something about threading coming back.
Yeah, so PDO threads is a thing. So you have hyaluronic acid fillers that volumize. Then you have biostimulators that stimulate the body to produce its own collagen elastin. Then you have these things called threads. Now, threads come in a lot of different sizes, a lot of different shapes, and probably the most popular threads that you're going to see are called barbed threads. So they kind of, it's like like imagine like a line, but almost like a fishing lure. It has tiny little spokes on that line. And we place those underneath the skin in specific vectors of the face to, so again, it's one of those things like maybe you don't want to have surgery. You're avidly against a facelift, but you're starting to get really, really heavy jowls. And I can't, for whatever reason, fix it with biostimulation or my other modalities. I might take a couple threads and go into the jowl and then lift it and pull it laterally, and tell you that you're going to have it done about twice a year.
Am I crazy? I thought there was some problem with that at some point.
They,
Threading.
yeah. So the thing with threads is that, again, depending on your state, depending on the legalities of who can perform these procedures and who can't, there can be problems with them. Because in Texas, you don't have to be licensed to do a lot of these things. So Texas is kind of the wild, wild west. It's a good thing and a bad thing. But when it comes to threads, if you put threads in the wrong tissue, it can cause like puckering of the skin, so it looks like an unnatural result. If you put it into the wrong tissue, it can cause a buildup of scarring. So you have to go to someone who's really an advocate for threads, who knows what they're doing, who knows what layer of the skin they need to be put in. Again, not someone who just does it once every few months, someone who's an expert in their field at threads.
One more question before we take a
Sure.
break, and then when we come
Yeah.
back, we're going to talk about creams and lotion,
Yeah.
my hands.
Yeah.
Again, laid out with baby oil, ruin the
Yes.
skin.
Y-
What
w-
is the best thing? Because I know a lot of women my age who maybe their
Yeah.
face looks pretty good, but they look at their
uh
hands and they're like, wow, that really looks 69.
Yeah. Yeah. So what I like to do, if you want to stay non-invasive or minimally invasive, is a combination of a biostimulator, and the one I use is a Radius, with resurfacing on the hand. So the resurfacing helps thickens the skin and then helps to clear out any sun damage or dark spots. And then the biostimulation helps to add volume to the skin and thicken it at the same time. So as you age, you lose fat in the back of your hand, so you start to look bony and veiny. And then the skin starts to thin, so then you can see the blood vessels underneath it, and then you get
Mhm.
the freckles that come out. So it's a combination. It's a combination of everything. But I find the best treatment if your surgery's out of the question is a combination of a product called Radius, and then stacking it with some laser resurfacing.
Okay, we're going to come back and talk
So,
about the best creams, exosomes, which
yeah.
is like something I'm hearing about, and a couple more things in a minute. I'm really excited to offer you something starting in 2026. You know, this podcast is for women who are interested in being lifelong learners, living as well and as long as we can in a wonderful, purposeful way. Well, one of the things I love to do most is travel. And beginning in 2026, I have exciting travel opportunities to offer to you. I have chosen a provider who I trust because I have known Casey with Sharon Carr Travel for years now. Casey has traveled all the continents, he's been all over the world. And if you have any travel needs at all, whether it's a tour with me or maybe you just want to go somewhere on your own, Casey at Sharon Carr Travel will take you there safely, in style, and you'll have a wonderful time. Thank you, Sharon Carr Travel, for being one of the sponsors of Ageless with Jane McGarry and supporting all of us women. I don't know if this is just my imagination, but I truly believe when I get good sleep, when I eat right, when I exercise every day, I think it makes a noticeable difference in my skin, even the sagging kind of stuff. Is that just my imagination or is it true?
No, it's true. I mean, it's true because not only when you exercise, there's a lot of things that happen. So when you exercise, you increase your heart rate, and when you increase your heart rate, it stimulates blood circulation throughout your entire body. And also, when you exercise, your body breaks down toxins that are built up in your body and flushes them through your system. And then when you compound that with healthy eating, so less toxins, and you can add in drinking plenty of fluids or hydration, your skin will look its best. So, not only by exercising are you increasing blood delivery to the area, which means you're getting better tissue oxygenation and better nutrient delivery supply to all the cells throughout your body, but it's also pushing that hydration out too. So, yeah, there. Unfortunately, I'm not a big exercise person myself, but good clean diet, good exercise, and good amount of fluids throughout the day will make your skin look better.
And there's actually a science reason. I
There
mean, it
is
actually is
actually
a
science
thing.
behind
It's
it.
not just
Yeah, it
my
is a thing.
imagination.
It is a thing.
Okay.
It is a thing.
You said this at the beginning. There are a million skin products out there. There are a million right now.
Yeah, yeah, yeah,
You have recommended a couple to me that I really like. I'm not getting a cut off of any of this or
yeah,
anything
yeah.
like that. But
Yeah.
for a woman who is, let's say 50 up, what do you need to be doing? And I'm not a big 13,000 products person either. What's a
Okay.
simple good routine and what are good products?
Okay. So I have a my criteria specifically for any product that I carry in my office is that they have to have their own research and development, and they have to have their own histology, which means that they are doing biopsies of the skin that they put their product on and measured that there are actual cellular changes to the skin, not just what we see topically. Now, a lot of the other 20,000 brands that are available in the US can do like studies that are pseudoscience, where they do only focus on patient reported outcomes. So it's like they ask patients questionnaires like, does your skin feel hydrated? Does your skin feel more luminous, etc., which is very subjective, because you could put mayonnaise on your skin, and if you have the right skin, might make your skin look better. You know what I mean? But everyone knows that's not going to be the best thing for you long term. So I have to make sure that there's true science behind what I'm doing in my skincare. So the first one is going to be some sort of growth factor. My favorite growth factor is a product called Plated. It uses something called platelet-derived exosomes, which I think we'll talk about in a second, that stimulates the body's healing cascade, but it also produces collagen more so than I've seen in any other skincare product. And they have great clinical research studies that shows that it increases your collagen by about 200% within about 90 days, which is unheard of in a topical. So that's probably like my biggest selling product. My next product is something to prevent oxidative stress on the skin throughout the day. Because not only, eating healthy, exercising, drinking plenty of fluids is important to treat your skin from the inside out, but there's a lot of environmental factors that hurt us from the outside in. It's down. But even pollution in the air, things like that can hurt our skin. So you have to have some sort of antioxidant that's fighting that off. And typically that's found in the cosmetic industry, and the skincare industry is found in some sort of vitamin C. Now, not all vitamin C's are created equally. My favorite one is THD ascorbate, which there's two vitamin C's that I use, sodium ascorbate and THD ascorbate. So the two vitamin C's that I recommend, one is from a brand called Elastin, and then another one is from a brand called Revision. And those are probably the top two vitamin C's, in my opinion, on the market that have excellent, incredible science behind them. The last product in the morning would be something to protect your skin. So you have to have a sunblock. Now, sunblock has evolved way past what we understand of sunblock. And there is a product out now called Pavise that if you were just to put one thing on your skin in the morning every day, I would recommend this be the product, because it is not only a sunblock, but it also has anti-aging peptides in it. So it helps to stimulate collagen and elastin. It helps to drive all of your active ingredients of every single skincare product that you use with it deeper into the skin. And it gives you protection against environmental stress and the sun for 6 to 9 hours. Because if you read the back of the sunblock that you buy at the store, it says reapply every 80 minutes or every 120 minutes.
Mhm.
And no one I know, even my best clients, walk around with sunblock in their purse, right? And they're not putting it on every day, every 2 hours throughout the day, unless they're at the pool or at the beach or something like that. So we're still getting that sun damage, even though we think so. Pavise came to the market with an extended protection anti-aging anti-aging cream that combines anti-aging properties with UV protection that lasts about 6 to 9 hours. So fantastic product in the morning.
And I'll put
Uh,
these in the show notes. So you
yeah,
have
yeah,
those
absolutely.
three. Then what about a moisturizer or
Yeah. So typically most of those will have a humectant in it, or they'll have a hyaluronic acid in it. So they'll have a moisturizing component to it. So you don't have to have an additional moisturizer unless you're like just really dry or you like a more intense moisture. And then for that, I really like Ericlea has a great product for moisturizing. Revision has some great moisturizers. Elastin has some great moisturizers. So whatever your skin likes to drink up is what I would recommend. And we tried a couple different textures on the back of your hand, and you just kind of tell me which one you like. My last product that I would say is a night product, and that's going to be something to stimulate cell turnover. And the gold standard forever has been tretinoin, which is your retin A. So that's still a gold standard in our industry. We're making them a lot smarter now. Now we have different delivery systems to make them drive them deeper into the skin. So you're not as red, you're not as irritated, you're not as dry. And we're mixing them with things like niacinamide or B vitamins. So they're more conditioning to the skin. So a good prescription grade tretinoin at night. It would be my fourth product. So, I mean, you just with those four products, you can dramatically change your skin within about 90 days.
you mentioned plated having the exosomes.
Yeah,
That's kind
yeah.
of a big thing right now. What is that?
Yeah. So exosomes are chemical, well, they're messenger cells that are found throughout our entire body, that basically tell stem cells what to do. So I think of stem cells as airplanes, okay? And I think of exosomes as air traffic controllers with little orange, things on the airport, like telling the airplanes where to go and what to do. Yeah. So exosomes are kind of a buzzword right now in the industry because we know that they help, especially inter-procedure or post-procedure, that they decrease healing time and increase results. What we don't know is like what source of exosome is the best, because there's all kinds of sources. You can get them from umbilical derived, you can get them from placental derived, you can get them from platelet derived, which is the plated product. So we don't know what source is the best yet, and we don't know what quantity is the best yet. So even though exosomes is a buzzword, when I'm thinking of collagen and I'm thinking about anti-aging, I have to look at the science. And right now, plated, the product that we carry in the office here, the reason why I carry it is because it's the best at the science that's available right now. And it does have a platelet-derived exosome in it. And basically, it just tells your body's stem cells to produce more collagen, more elastin.
David, you have someone waiting who is numbing right now,
Yeah,
actually, waiting for a procedure. So I'm going
yeah,
to let you go.
awesome.
Quickly before I say goodbye, because I'm going to put your
Sure, yeah,
information in the show notes so people can call you,
absolutely.
get an appointment for consultation or whatever. What's most rewarding about what you do?
Ooh, there's a specific feeling that you get when you hand someone a mirror and like their eyes water, or you've just taken a weight off their shoulder of something that's bothered them, or something that they didn't think they could fix, or something that for whatever reason, I look at them and I think it's no big deal, but for some whatever reason, it's hurt their self-esteem, or it's made them be a wallflower or something like that. So there's a certain amount of, I don't know, spiritual fulfillment I get out of helping people just feel their best and look their best. And to kind of see that confidence build in my patients, because I've been doing this for 24 years and I have patients that I've been seeing for decades. And just seeing that confidence be built over time, and these people change. And, someone who comes in who is sad and frowning, and then, I spend some time with me, and then, every time they come in, they're smiling, they're happy. I mean, just seeing that shift in the confidence in a woman, or even I have male patients too, but obviously my biggest population is female. But just seeing that confidence shift, of just seeing someone just be like, oh, wow, I feel good about this now. It just makes me feel good. It makes me feel good that I can make other people feel good about themselves.
Thank you so much, David. Appreciate your
Yeah.
time.
Thank you.
Thank you.
Thank you, Jane. Have a good day.
I just love him. I trust him. And as you can see, he's just a really good person. And speaking of good person, you for being here with me, exploring all the good things, the hard things, the challenging things about being a woman who is growing. Because that's what aging is. It's growing. We're all growing together. And I appreciate you being part of this community where we can share our experiences, learn from each other, and make each day the most positive, wonderful day it can be, because all we have is the present. Be present in your day today. Thank you for being part of our community.